Hello, we have been joined by Dr. Renu Swarup. Thank you so much, ma'am, for joining us. So, the first question is: how do you find the diagnostic sector in accelerating innovation, diversifying testing, and leveraging public private partnerships?
The diagnostic sector, in fact, over the last couple of years has really seen a transformational change. We have now moved from this being just for a elite class to becoming a tool that we are using for the masses. COVID showed it to us. We had diagnostic kits all over, used across by the entire population for our screening, the largest number of testing that was done within the country. Innovation plays a very important role in this. And today we have innovation which is playing an important role in diagnostics across different diseases, all infectious diseases. We're looking at a large number of chronic diseases, lifestyle diseases, maternal and child health, prenatal, newborn screening, because the technologies are different, the innovations are different, right from molecular diagnostics to medical electronics to biomarker based technologies, genomic technologies, artificial intelligence. We have a plethora of these. And I think that is really what is driving this whole sector. And we are seeing the impact also because you have affordable diagnostics which are now being made available for different diseases. And we are also seeing that it is becoming an important healthcare intervention for many, many diseases. And tuberculosis is again one of them where we've deployed the TrueNat, which is a molecular diagnostic kit, and that's been deployed in large numbers. We also sort of tweaked around with it and we used it for COVID, but many of them are really moving ahead.
Okay, so we are seeing a rising threat of diseases and especially concerns around the disease X. So, learning from the COVID pandemic, how do you see or what are the measures that need to be taken to contain the disease timely, the new diseases that we see?
So, COVID gave us obviously, it was a pandemic which put us all into such a big crisis, but it gave us a lot of learning. And the learning it gave us was how do you come together to respond to these sort of health crises and health emergencies. One such emergency immediately was that how do you stay prepared so that you don't really, you're not just taken aback when any such crisis hits you. I think the key aspect that played a very major role in managing COVID was technology. It was collaboration. And more importantly, it was also a commitment to be able to deliver. And I think that's really what is working now. Disease X or any others, we're all working towards how do we respond to that and at the shortest time frame. We built a very strong ecosystem during COVID. We sort of assessed our gaps, not just within the country, but globally. Globally, all players came together. Whether it was national players, academia, industry, government, policymakers, community health workers, industry from overseas, all came together. And we have now also learned that it's very important to share knowledge, share data, and with this be prepared. So the other aspect that also is now helping us is the COVID really taught us that it's important to develop these platform technologies. And these platform technologies can then be deployed for whatever crisis comes in, whether it's the vaccines or whether it's the diagnostics. Another very strong component that we built was the surveillance. And genomic surveillance played a very major role, which was linked or connected with the epidemiological surveillance. These networks have been built across countries. India, we built a very strong INSACOG network. We built a strong vaccine. We are so proud of our vaccine development platform that we created, diagnostics. So I think what is important is now how do we continue to use this robust ecosystem so that it's continuously updated, it's continuously kept abreast with all the new developments, and it also takes into account the forecasts that come in for different health emergencies and priorities.
And my last question is: what are your takeaways from IDS Summit today?
This is a good summit that you put together, and the key aspects that you've covered in terms of cost, quality, regulation, So very important for the diagnostics. In fact, they're important for all innovations. Your focus was on diagnostics. What you have discussed for diagnostics can actually be taken forward for other sectors of pharma as well. I think the key point that I saw in your summit is that you had all different stakeholders in it, whether it was the policymakers, whether it was the large industry, the startups, the academic researchers, more than just listening to the various panel discussions and keynote speakers, you have given them a platform to interact with each other. And I think they need more of this, because that's where connections come in, and that's where they learn from each other's, and all the good practices that they have, but they also build connections to be able to see how they could take forward. So, good summit. I wish you great success. And I hope that since this has been organized by ET, I am sure that the dissemination of what you've captured in this summit would be done in a very, very large way, so that even those who've not attended this summit would be able to get glimpse of what the key discussion points were, because that is important for all players who are in this sector. So all the best and wish you good luck.
Thank you so much, ma'am. Thank you for joining us.
Thank you.